Hello and welcome. You're watching NDTV. I'm Sarah Jacob. Here are the headlines. Delhi reports 19,486 COVID cases in the last 24 hours, 141 deaths. Its biggest one-day COVID death count. The weekend lockdown begins. India sees a record high in new COVID cases, over 2 lakh cases for the second straight day. A shortage of medical oxygen in numerous states. A 2-day wait list for getting a COVID test in the national capital, and bodies pile up waiting to be cremated in Varanasi. The BJP tells the Election Commission, don't shorten polls. There's no connection between a rise in COVID cases and election rallies. Assures the EC that it will follow COVID protocol. The Home Minister takes out a roadshow in Kolkata, doesn't even wear a mask. Andhra Pradesh runs out of vaccine stocks. This 2 days after recording 6.2 lakh vaccinations. Karnataka reports 14,000 new cases despite experiencing COVID symptoms. The Chief Minister holds an emergency meeting on COVID. He announces he's COVID positive for the second time soon after. COVID predominantly spreads through the air, says the latest Lancet study, not so much via contaminated surfaces. Recommends a limit on gatherings, no gatherings of groups larger than 10 for 2 months. And after thousands gather at the Kumbh, 30 sadhus test positive, 1 dies while being treated for a coronavirus infection. 30 police personnel deputed on Kumbh duty now are positive. And fugitive billionaire Nirav Modi's extradition to India is cleared by the UK government. He still has the option of legally challenging the order. The top story, the national capital has recorded 19,486 coronavirus cases and the highest ever deaths of 141 patients dying in 24 hours. The positivity rate has also been around 20% in the last 24 hours, and these numbers come even as Delhi now begins its stringent weekend lockdown from 10 p.m. on Friday to 5 a.m. on Monday, all in an effort to check the alarming surge in coronavirus cases. Let's go across to Arvind Gunasekar, who's out on the streets of Delhi right now. Arvind, Delhi will be living under a curfew this weekend. What are the streets looking like where you are?
Yeah, Sarah, this is the central market in Lajpat Nagar. You could see this is one of the most buzzing places in the South Delhi, but now it looks completely deserted. You could see all shops are completely closed, hardly few vehicles on road. It's completely deserted here. In fact, we can't even see any people loitering around here. It's that clean. It's completely deserted here. So the weekend curfew has begun in the national capital. So it started sharply at 10 p.m. and it's still 5 a.m. on Monday. So this comes at a very important time because the Delhi government had imposed several restrictions, not just this weekend curfew, but also several restrictions on the restaurants and also spas and also auditoriums to check the large gathering of people. So this comes at a very important time when the national capital has reported closely 20,000 COVID cases and also around over 140 deaths. On both count, the national capital has set a record. What is more worrying is the positivity rate. The positivity rate in the national capital is still maintaining above 20%. So that's a very worrying sign. Even today, the Delhi Chief Minister had called for an emergency meeting to review the COVID situation with the health department officials. So what we are being told is that the ministry, the health department, will be coming up with several measures to check this steep alarming rise in COVID cases in the national capital. They will also come up with several measures to break the chain of transmission. So also what is very worrying is that even now when we check the Corona app, Delhi Corona app, what it's showing is that almost 73% of the COVID beds are already occupied. If you you could see the ICU beds, almost 87% of the ICU beds are occupied, and if you could check the ventilators data, almost 89% of the ventilators are already occupied. So this is a worrying sign, and that's why the Delhi government has come up with such stringent measures to break the chain of transmission. And what we are seeing is that almost people, we can't see any police personnel here. It's clear that the people here, they themselves are complying with the restrictions of the government here to break the chain of transmission. Sarah?
Arvind Gunasekar, thanks for that update. So the Chief Minister had said that the restrictions are being imposed in the capital to arrest the spread of the virus, which has put medical infrastructure and health workers under tremendous strain. In Delhi, it's a shortage of testing facilities. If anyone exhibits coronavirus symptoms, there could be a 48-hour-long harrowing wait just to get tested.
Getting a COVID test can now take hours or even a day or two in Delhi, which is reporting 16 to 17,000 cases a day, worse than Pune and Mumbai.
Online was taking about 3 to 4 days for us to get an online slot. So I thought, let me come here and see what the situation is.
But do you believe this is a far more riskier, I mean, for especially senior citizens to walk in?
Yeah, there's a lot of gathering of people also, so yeah, it is definitely more risky.
But with a delayed time in booking a test comes delayed reports. COVID-19 volunteers NDTV spoke to did not want to be identified.
जो पीछे जब केसेस कम हो रहे थे तो उस टाइम तो 24 घंटे में ही आ रही थी रिपोर्ट।
जी।
लेकिन अब सैंपल ज्यादा लिए जा रहे हैं ना, प्राइवेट से भी लोग बहुत सैंपल दे रहे हैं, गवर्नमेंट से भी बहुत सैंपल दे रहे हैं
जी,
लेकिन लैब जो है करने वाली उतनी है, तो इसलिए सब वेटिंग में चल रहा है।
बहुत सारे पेशेंट्स की क्वेरी है कि उनकी जैसे वो बुक करते हैं, अगर उनकी स्लॉट उनको 2 दिन बाद भी मिल रहा है, 2 दिन बाद अगर वो टेस्ट करवा भी लेते हैं तो उनकी जो रिपोर्ट्स है वो 24 आवर्स में आ जाती थी, बट उसमें भी काफ़ी डिले हो रहा है जो कि 48 आवर्स में भी आ रही है.
So just to give you a sense of what it's like to book a COVID test online in these times, it looks like a difficult situation. I am trying to book a COVID test on a private lab, one of the most popular ones. I am on the website. The nearest location is what I will be selecting. So let's see if I can book myself a COVID-19 test request, and the message that I have got from here is, and if I can highlight and show it to you, we request your cooperation and patience as we are running at capacity. Let me take you through another website which also has the facility to book a COVID test online. As you can see, I'm going through the list over here, and as I try to book myself one, the message I get in big bold letters in red flagging off, currently we are not accepting any COVID RT-PCR orders. Fawad, a student in the national capital, wanted to get a COVID test done after he showed symptoms. Several COVID testing labs that we spoke to told us that they have become overstretched and overwhelmed with the response of the incoming bookings. So much so that they have had to close down their online bookings or keep callers waiting. An unprecedented health emergency, leaving many gasping for the basics. In New Delhi, with camera person Sushil Rathi, Shanakshi Chakravarti for NDTV.
And if it's a nightmarish shortage of testing facilities in Delhi, it's a harrowing shortage of remdesivir in Maharashtra, a state that has reported the biggest ever single-day surge in coronavirus cases, logging 63,000 infections and 398 deaths in a day.
These are family members of COVID patients sitting on dharna outside the Pune district collector's office protesting against the non-availability of remdesivir injection.
मेरे डैड पिछले 6 दिन से हॉस्पिटल में एडमिट है और जिस दिन से एडमिट है उनके मेडिकेशन अभी तक पूरी तरह चालू नहीं हुए हैं, वो आईसीयू में है. 6 दिन से हम ये रेमडेसिविर जो इंजेक्शन है वो ढूंढ रहे हैं. पुणे, सातारा, कोल्हापुर, सांगली, ऐसी कोई भी सिटी नहीं है महाराष्ट्र में जो हमने छोड़ी होगी.
अस्पताल में बोल रहे कि आपको बाहर मिलेंगे, आपको बाहर से इंतजाम करना पड़ेगा, नहीं तो पेशेंट को कुछ हुआ तो हमारी जिम्मेदारी नहीं है. तो हम यहाँ पे आए तो यहाँ पे ब्लैक मार्केटिंग चल रही है ससून के अंदर, तो इसलिए हम यहाँ पे आंदोलन कर रहे हैं.
Doctors believe using remdesivir at the right time can prevent the patient from deteriorating. Dr. Wagmare, who treats COVID patients in several government COVID hospitals in Mumbai, points out that remdesivir works on 70 to 80% of the patients.
70 to 80% में पेशेंट में इसके रिजल्ट्स अच्छे हैं. तो हॉस्पिटल में जितना टाइम पेशेंट को रुकना पड़ता है उसका ड्यूरेशन कम हो जाता है और ऑक्सीजन रिक्वायरमेंट कम होती है.
Doctors, however, strictly caution against its unsupervised use.
होम क्वारंटाइन पेशेंट में जस्टिफाइड नहीं है, ओनली हॉस्पिटलाइज्ड पेशेंट्स में यूज करना चाहिए ऐसे बोल के टास्क फोर्स का रिकमेंडेशन भी है और अंडरस्टैंडिंग भी है.
There have been allegations that remdesivir is being prescribed more in private hospitals. Now the government is allotting it to patients only through district collectors, and drug inspectors are investigating complaints of black marketing. In Mumbai, with Pooja Bhardwaj, Saurabh Gupta, NDTV.
And the Karnataka Chief Minister tested positive for the coronavirus for the second time. Ironically, he held a physical meeting with his team on tackling the virus while awaiting a COVID-19 test result. This on a day when Karnataka and Bengaluru saw record spikes in new cases, reporting over 14,800 COVID-19 cases on Friday.
Karnataka Chief Minister B.S. Yediyurappa adding to the number of positive COVID cases being reported from the state. The Chief Minister tweeted that he was tested after developing a mild fever and was being hospitalized despite doing fine on the advice of doctors. Just before this announcement, the Chief Minister had headed a hurriedly convened meeting on COVID-19 at his residence after the state and capital Bengaluru registered record highs in terms of new cases. The city now has the third highest number of active cases in the country. But there is still no talk of lockdown and no change in the existing curbs in the state.
Corona cases is going on very high. So we have discussed in detail from 1.5 hours with our officers, and we are going to take final decision, and to that time same thing will continue.
The Health Minister said the discussion focused on clinical management of patients and how to control case numbers.
All these form of conjugations will be discouraged. Only those who are having severe symptoms, who are having comorbidity and absolutely requires medical attention, such people will be admitted only in the hospitals.
This means night curfew in Bengaluru and 6 other cities stays until the 20th of this month and maybe later. The state had a major festival earlier this week, Yugadi. Ramzan has also begun with restrictions in place. With DM Kumar, Maya Sharma in Bengaluru for NDTV.
And after a shortage of remdesivir in Maharashtra, Gujarat, UP and MP, and a shortage of medical oxygen supply in MP, Gujarat, Punjab, Andhra Pradesh now says it's out of stocks of the COVID-19 vaccine.
Andhra Pradesh Chief Minister Y.S. Jaganmohan Reddy has written to Prime Minister Narendra Modi saying COVID vaccine stocks have completely run out in the state. The CM has sought 60 lakh doses for Andhra Pradesh, promising to administer within 3 weeks the first dose of vaccine to the entire eligible population above 45 years in the state. On Wednesday, Andhra Pradesh administered a record 6,28,000 doses, the highest by any state on a single day. On Thursday, only 28,000 doses could be given as the state ran out of stock. Last Wednesday, vaccination had stopped in 2 districts of Andhra Pradesh, Nellore and West Godavari, as they ran out of vaccine. Subsequently, the state was sent 6.4 lakh doses after the Chief Minister had asked for 25 lakh doses. Andhra Pradesh has vaccinated just about 5% of its population, and vaccine shortage is proving to be a challenge at a time when the state wants to expedite vaccine coverage, even as the state is reporting nearly 300% increase in cases over the last fortnight, with over 5,000 cases every single day and a positivity rate more than the national average at over 6%. With camera person Nagraju, Uma Sudhir, NDTV.
And less than 10 days after insisting that there's no shortage of medical oxygen, even as hospitals across India red flagged low stocks and COVID patients died, the Centre on Friday evening issued its third emergency order in 24 hours, this time to ensure the uninterrupted supply of cylinders across state borders and to allow manufacturers and suppliers to serve hospitals across India. The Home Secretary has written to states to ensure uninterrupted supply of medical oxygen. This came hours after Prime Minister Modi was briefed about the centre's efforts to rapidly scale up production and supply oxygen cylinders, all this in the face of a deeply alarming and persisting spike in COVID cases across India.